Thank you very much for coming, and thank you, Optopol, for supporting our book. So this is not the very first book that we've published. In fact, this was the first book that Professor Wylęgała published in 2008. This comes from the fact that we had the first Visante in Europe, so we had the very technical edge in terms of this book. It was both the anterior and the posterior segment OCT. And you can still buy it for $377 if you are interested. But the best thing that I found on this is the 5-star bestseller. And not every book that that I looked at this bookstore is actually 5-star bestseller. So 2 years later, the big 2 atlases. So this one, I guess, 2 volumes, one for the anterior segment, one for the posterior segment. 2010, mostly Visante imaging, also a very nice atlas. And then 7 years later, so 2017, the 2 volumes, anterior and posterior segment. This was mostly based on the SWEP source, so this is the time of the, let's say, introduction of SWEP source, and everybody thought that SWEP source is going to be the main big thing, so we included a lot of SWEP source imaging in it. It was also a very nice book. But it lacked multiple things, which I right now hope to enjoy. And right now we are going to present the anterior segment OCT. So the thing that I really didn't like about this previous book is that it didn't have this application reality. So it had a theoretical knowledge of the diseases, but it was very hard to apply this. So I started this time from just a very simple graph, very simple table, showing you what kind of scans for what kind of implication you should use based on the applicability of these scans on the machine. So the book is divided into 5 parts. I wanted to start with the corneal topography, so very basics. And there is a lot of text, but I tried to make it as basically approachable as possible. Because I believe this was the biggest failure of our previous book, that we didn't have enough information about the corneal topography and all the indices that are within the machine. So it's naturally based on the type of analysis that you can find on Revo. For instance, here you have the explanation of the different types of keratoconus prediction indices. And then I try to also make it very straightforward in terms of like what's coming from where. If you have an elevation in keratoconus, and then it's coming to be the corneal thinning within the cone, and then you have this donut shape. So I try to make it very, very approachable. The next section is basically for basic users. So it's called fundamental science. So you have just fundamental things like how does hyphema look like, how does scarring looks like, how to measure limbal epithelial thickness. So this is the fundamental science for basic users. If you're experienced, you just can skip this. The most important one is obviously the conditions. So different conditions, corneal dystrophies are also presented. So for instance, this patient is an acute ocular burn with alkali. You cannot see anything. In the fundus, there's no fundus reflex. If you do the corneal scanning, you can see that there is the deciment membrane the attachment due to the hyphema. So it's basically all the conditions. I also try to make it very brief. So you have the case, then you have the photos, and then you have the description. Usually I try to make multiple arrows so that it will be self-explanatory. The 4 last part is the surgery. So you have mostly corneal transplant, different transplant, different types of complications, and that was the idea. And the last part is the glaucoma part. So the angle, also surgeries included are here. So I just want to show you 2 cases from our book. So this is a case of 14-year-old girl that was referred to us with suspicion of keratoconus. And you can see that there is some haze within the cornea. And when you do the pachymetry, you can see the corneal thinning, right? And then when you do the refraction, the corneal map, you can see that there is the compensatory epithelial thickening. And this leads to firstly the increase of astigmatism, which is basically related to this scar. So if you do the anterior segment scan, you can see everything that you saw on the maps. So you see scarring, you see the corneal epithelial thickening due to the compensation of the thinned stroma. This is the wide field scan. The girl doesn't have keratoconus, she has astigmatism, but coming from a previous inflammation. And this is something that such books are made for dystrophies. I also wanted to show you different stages of dystrophies, because I think this is the biggest drawbacks of many books, that they show you just this typical sign of dystrophy, this typical picture, and they don't really show you the natural cause, because let's say Avellino dystrophy is different in 12-year-old, it looks totally different than in 20-year-old. And also this dystrophy, on the clinical photo you can see some haze, but if you do the scan, it's very self-explanatory. It actually is on our cover. So this is the TL Benki. And this particular patient is a 20-year-old girl, because it's a whole family that I'm going to show you. And you see typical seesaw pattern, or if you like mountains, this is basically the peaks of the mountains. As you can say, the contralateral eye, wide field scans again. And if you look at the pachymetry, it's increased, like in most dystrophies except for macular. This patient is the brother. He's 12 years older. And you can see not only that he has the dystrophy, but also he has the Salzmann. So both eyes, Salzmann and the dystrophy. And this is how it looks. You can see the difference in reflectivity between the TL Benki and the Salzmann. Salzmann has slightly higher. It also causes the opacification. Again, this is the contralateral eye, high-res scan. Again, the other eye, the one that made into the book. And this is actually the grandmother of the family. Also TL Benki, but look how differently this dystrophy looks if it progresses into a very, very long period of time. Actually, if you're very accustomed to the anterior segment OCT, you can see that there is the thinning of the cornea, right? There is the compensatory epithelial thickening, and you can slightly see this sawtooth pattern, but only in the mid-periphery. You cannot see it within the anterior parts of the cornea. So again, as I mentioned, the patient has actually lower corneal, she has corneal thinning. So this was my idea, to show you not only the typical ones, but also show you the how this type of dystrophies progress, because they look totally different in the old and also in the adolescent patients. So this would be it. Thank you very much. I hope you enjoy my book. Right now we have made only 48 copies. I mean, it takes a very long time because these books are made very meticulously. So if you want the book, you need to ask the Optopol representative, or they will scan your badge and they will provide you with it. Okay, thank you very much.